8th September is the World Cystic Fibrosis Day. Now, why talk about cystic fibrosis now? Because cystic fibrosis was considered as a rare disorder in India. But we researchers has found out that cystic fibrosis is far more common in India. Why? Because our estimated incidence of cystic fibrosis in India is 1 in 40,000 live births. Now, if looking at this ratio and the population of India, I would say that India will be having the maximum number of cystic fibrosis patients in the world. But unfortunately, the awareness is not there. The awareness among the parents, among the public, and among the caregivers are very, very poor. Hence, this disease is not being recorded or identified in India. Now, what is cystic fibrosis and where this disease affects? Cystic fibrosis is a genetic disorder. It is an autosomal recessive disorder. Primarily, cystic fibrosis is affected in the lung and the pancreas. So, the children will have recurrent cough, recurrent pneumonia, they will have recurrent fever, recurrent wheezing. And then it affects the pancreas, so they will be malabsorption and they will lose weight, they will have recurrent diarrhea, they will have intestinal obstruction. So any child, right from the early childhood, if the child develops these kind of symptoms, the parents should definitely think about cystic fibrosis and then take them to the specialist to find out whether their children are having cystic fibrosis or not. Now, how do you diagnose cystic fibrosis? Primarily, in many of the hospitals now, the newborn, as soon as a baby is born, they check one test known as IRT, immunoreactive trypsin. If this is elevated, they will definitely look for cystic fibrosis. Now, people who do not have this test done and they in later years, if they have these symptoms, get the sweat chloride analysis done. And if the sweat chloride analysis shows the sweat chloride value more than 60 milliequivalent, then that has to be considered as a cystic fibrosis case. So then the caregiver will do a genetic study so that we can identify what is the mutation, because in certain mutations we can use some kind of a medication known as CFTR modulator, which is not freely available in India. So in this cystic fibrosis day, I just wanted to create the awareness among the parents, among the public, and among the caregivers throughout India, so that we can identify disease very early and then start treating these people so that the burden of the disease can be limited in these people and that we can give them a very good life and a longer life. Now, we at Surya Hospital, we have a very good cystic fibrosis center. It is one of the earliest center in India where we take care of cystic fibrosis patients, all aspects, diagnosis, treatment, and then follow-up. So we have around 200 patients which has been registered in our registry, and out of it, about 40 patients are coming for reviews from throughout India, mostly from the southern India. Thank you.